more than 40 years of age will be usually affected with symptoms. So it has very important role in men's health and men's sexual health also. When the age increases, risk also increase. There are multiple treatment options depending upon the stage of the disease and the aggressiveness of tumor.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. 𝐃𝐑 protects your skin.
Hello dear friends, good evening. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. This is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Today we will be discussing about prostate gland. It's a gland found only in males, but they become aware of it only when something goes wrong. To throw more light to the topic, we have with us Dr. Anil Bhasi from Al Hilal Hospital, Muharraq branch. He is a specialist urologist. Doctor, welcome to the show.
Thank you. Good evening all. Thank you for having me here.
Thank you for joining us today, Doctor. Doctor, can you explain about prostate in detail for us and also about its role in men's health?
Prostate is a small gland. It's the size of a walnut. It is found only in male and it's located just beneath the urinary bladder and it's surrounding the urethra. Urethra is the passage through which urine is passing, and it has a very important role in the sexual function of male. So it's considered as an accessory sexual gland. The main function, it produces a fluid which nourishes the sperm and it protects the sperm also. And also it acts as a valve, so preventing semen from going into the bladder during ejaculation. So it directs the semen to outside rather than going into the bladder. So it has very important role in men's health and men's sexual health also. And also it is associated with different diseases also.
Around what age men should be aware of their prostate health?
And prostate health symptoms can develop at any age, but mostly it is a prostate enlargement. If you are talking about prostate enlargement, it's more of an elderly patient. More than 40 years of age will be usually affected with symptoms. Even young patients have other infections or inflammation of prostate, So there can be any age group which can present almost similar symptom, but the etiology will be different for both age group.
And is prostate enlargement a part of normal aging?
It's a normal aging process, as if graying hair. So by the age of teen, it becomes almost double the size compared to the children. But after the age of 25, it started increasing gradually in size. And over years, it grows until person lives. So it's a part of normal aging process only.
Now, can you speak about the most common prostate problems men face?
Actually, there are two groups of patients presenting. One is young patient around 20s, 30 years with complaints of some urinary symptoms like some frequency or some pain during the urination or pain during ejaculation. These are like infections of the prostate rather than caused by prostatic enlargement. The other group are elderly people, more than 50-60 years, presenting with mostly of poor stream, and the associated with pain will be there, and they will be going multiple times to the toilet for passing urine. Even their sleep will be disturbed because they will be waking up at least 3-4 times in the night to pass the urine. These symptoms are more related to the enlargement of prostate.
Now, apart from this, what are the other early warning signs men should never ignore?
There are actually no warning signs to separate from a benign disease and a serious problem. Almost all symptoms will be overlapping. Most commonly, patient will have pain during passing urine, or will be frequently passing urine, or there will be difficulty to initiate the urine, and sometimes will have night time you have to wake up multiple times to pass the urine. There are multiple reasons for that. These can overlap also. There can be infections of the prostate, infections of bladder, maybe caused by a stone in the bladder or ureter, and prostatic enlargement also. That enlargement can be either a benign disease or it's part of a malignant disease. Without proper examination and evaluation, it cannot be concluded what is the problem. Usually what happens when patient have some burning sensation of urine, they will go to the pharmacy. From over the counter they will get some antibiotics or some painkiller, and it subsides. But it will recur again and again because we are not addressed the underlying problem. The ideal thing should be, you should evaluate for the reason and find out the reason and treat the reason. Then only you will have a proper result of your treatment.
Can prostate problems exist without any symptoms?
It can be. There is a common misconception that prostate has to be enlarged to produce the symptom, and the symptom is directly proportional to the size of the prostate. Most people think like that. If prostates are very enlarged, so will have more symptoms. If it's not of large size, they will not have less symptoms. There is nothing like that. There is no correlation between the size of the prostate and the symptom it produces. Basically, how much obstruction is causing to the urinary flow, depending upon the shape of the prostate and the way it is growing into the urethra. I already mentioned that urethra is passing through the prostate. The growth happening into the urethra and causes the obstruction of the urinary flow, then only symptoms will develop. There can be people with 80 or 100 gram of prostate with not much symptom. Somebody with 30 gram of prostate having severe symptom. So the size cannot be the ultimately thing, but size matters. It plays a role in defining the therapy, which medicine to be given. If you are planning for surgical intervention, what is the surgery to be done for this patient? These are all depending upon the size of prostate. But symptom doesn't have a direct correlation to the size of the prostate.
Now, can you explain about BPH and how common is it?
BPH is mentioned as benign prostatic hyperplasia. Now we use the term benign prostatic enlargement. That is, the prostate is growing, it's large in size, but it's not related to any malignancy or cancerous process. And it's a part of a normal aging process, and it depending upon the age of patient. If the patient is less than 40 years, then the risk is only 8 to 10%. That means less than 40, only 1 in 10 patient will have some symptoms. But if crosses 40 to 50, the incidence increased to 50%. That means a person of age of 50, almost half people will be having the same symptom. Then it crosses to 70, then around 70% of people will be having a large prostate.
Now, can you speak about some lifestyle changes that can reduce the prostate enlargement?
As of now, there is no direct evidence that some lifestyle changes can reduce the prostate size, because it's a natural process. It will grow in size with age, but your lifestyle cannot change the size of the prostate. Once it has enlargement, it's enlarged. So nothing can be reducing the size, but there are definitely lifestyle things which causes the symptomatology. So if you are having some particular lifestyle, like if you are taking alcohol, if you are a chronic smoker, and you are having obesity, and you are having a sedentary lifestyle, like you are not at all exercising and all, and you take too much of spicy food, caffeinated drinks, all these things can increase the prostatic symptoms. It will not affect the size, but it can increase the symptoms. And if you are taking too much sugar spike can also cause the prostatic symptom. Basically, if you are following healthy lifestyle, even with an enlarged prostate, your symptoms will not be bothering you.
So when a patient comes to you with prostate problem, when do you suggest surgery?
Depending upon the patient age and the patient symptoms and the response to treatment, initially we will consider only medical therapy, and with an optimal medical therapy, if patient is having a good symptomatic relief, we will wait for surgical procedure. But even after optimal medical therapy, patient is not satisfied with the outcome, and if life is bothered by the symptom, then we can proceed with the surgical part of the treatment. And there are multiple options for the surgery, and there are definitive indications for surgery, like if there is multiple episodes of urinary tract infection, severe bleeding, and there is kidney damage because of the prostate, or we are suspecting some stones in the bladder because of this prostatic enlargement. This time medical therapy will not work. We'll have to go for a surgical procedure.
Now coming to prostate cancer, how common is it globally and also in our region?
Prostate cancer is a very common cancer, almost second in number compared to the world population. First is lung cancer, and the second one is prostate cancer in men. And it's quite common in the Bahrain also. If you consider the GCC, Bahrain is the almost the population number is considered, it has higher incidence compared to other part. It's because of the aging population, and also because of the medical facility available. More patients get tested, so more cases are getting detected. So it's a very common problem.
And doctor, what are the risk factors associated with prostate cancer?
There are two types of risk factors. One is non-modifiable, that is related to your age. When the age increases, risk also increases. Once you cross 80, there is 80% risk of developing prostate cancer. And other thing is your genetic. If your family member, somebody, father or a brother is affected with the prostate cancer, there is almost double the risk of developing. And if they are diagnosed at the young age, there is still higher chance of developing. And some ethnicity like Africans, they have increased risk of developing. And modifiable risk factors are there. That's basically your body mass index. If you are obese, there is increased risk. And if you are a smoker, and if your diet is more of a red meat and fat included in fat, then there is an increased risk of prostate cancer.
You already mentioned about the test to be done for prostate cancer. Can you explain it in detail? What are the tests to be done for early detection?
The best management strategy is to detect early, because early prostate cancer can be completely cured with therapy. So we should find out at the early stages. This includes a physical examination by a doctor to feel the prostate, how the shape of prostate is there, any suspicious areas there or not. Second one is PSA test, that tells you there is something going wrong inside the prostate, even without the enlargement also. In these tests, if something suspicious find out, then we have to go for an MRI to see the prostate. In MRI also we find some lesion, then we have to confirm it with the biopsy. Biopsy is mandatory for confirmation and the staging process, and to detect whether it's an aggressive or non-aggressive tumor.
Around what age men should go for PSA test?
More than 45 years, it's a mandatory to get tested, because that is the age when symptoms start. And if your family history is there, it will be younger. Around 40, you should get tested for PSA.
Now, can you speak about the treatment options available today?
There are multiple treatment options depending upon the stage of the disease and the aggressiveness of tumor. There can be very low aggressive tumor which doesn't require a intensive therapy, which can be observed, which can be treated with minimally invasive therapies. And there are other tumors which has already spread to other part, which requires a higher treatment modalities. Basically, treatment is surgical part. if the prostate cancer is diagnosed, if it is an early stage, you have to remove the prostate and it will give a complete cure. Other treatment parts include hormonal therapy, immunotherapy, or radiation or chemotherapy, depending upon the stage of the cancer.
And doctor, what is the one advice you want the men who are watching this show to keep in mind?
The one thing you have to be aware of the symptomatology. If you are having any urinary symptoms, rather than taking an over-the-counter medication, it's better to be evaluated properly. And you should have a good lifestyle. Try to avoid alcohol, avoid smoking, and keep a healthy diet. Diet rich in fresh fruits, vegetables, and less in red meat. And reduce the stress level. You have to do some kind of physical exercise. If you are having a sedentary lifestyle, you should have at least 20 to 30 minutes of some kind of physical activity, or at least 4 to 5 days per day, 4 to 5 days per week.
Thank you, doctor. Thank you for joining us today and giving us a lot of valuable information about prostate health.
Thank you for inviting me here.
So viewers, this discussion reminds us that prostate problems are common, but awareness and early detection can make a large difference. I hope this episode was helpful. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time with a new doctor and a new topic, this is 𝑭𝑨𝑚𝑺 signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. 𝐶𝐵𝑚 protects your skin.